I'm Yawa Digboe with Arlington Public News. I'm here with Bill Massacoy.
Good morning, Yawa. Thank you. It's my pleasure to be here this morning. I am the founder and executive director of Rebuild Africa, and the objective of Rebuild Africa is to support education, training and mentoring back home. As you know, because of the many years of civil war in Liberia, a lot of people died. Many of the professionals left the country, and educational institutions were damaged.
Mm-hmm. And now Ebola, obviously.
Yes, now Ebola, because it looks like everyone's attention is turning to this deadly virus. As you know, it's very virulent. It has killed over 3,000 people now in Liberia, Sierra Leone, and Guinea. And over half of the people who've died so far are from Liberia. And the disease is spreading very rapidly in Liberia as well. So that's a very sad situation.
How did it change the mission of the organization?
Well, I wouldn't say that it changed our mission per se, but it certainly made us to, I wouldn't say stop, but to deal with the emergency. Like when people are dying, you need to keep them alive before you educate them, put it that way. So all of a sudden, all of us who run local organizations found ourselves grappling with this virus. It's not only threatening our various organizations, but our very lives, and indeed the existence of our country. So I guess at this point, it's all hands on deck, because we all need to do our part to fight this disease. For our part, Rebuild Africa, one of the things we did, because we knew we were not a health institution, so one of the things we did was to partner with a mission organization. They run a hospital, and this hospital has been the very first in the front line of fighting the Ebola. If you remember, 3 of the U.S. health workers who got infected in Liberia, Dr. Brindley, Nancy, and Dr. Rick Sikra, all worked from that hospital. In fact, I had the privilege of working with Dr. Sikra many times, many occasions, trying to raise more support to support the Elwa Hospital in Monrovia until he got infected and was brought to the U.S. For treatment. So we have joined them. We support them, and we raise resources and channel it to them to help them fight the disease, and that's what we're doing.
So could you remind us how people contract Ebola? How do they get infected, and what's contributed to the spread of Ebola in Liberia?
It's really been spreading like wildfire. We've had families in which almost nearly all members of the family have died from Ebola. There are places where a whole family has been decimated, completely wiped out because of Ebola. Because in Africa, we also have very strong culture. It's very communal. When you do get sick, there are people who come to take care of you. There are people who are always there to serve you and to make sure that you receive everything you need to get well. And unfortunately, there's sometimes, at least in this case of Ebola, it's showing that doing that for a family member or a relative, it's just not the right thing to do, but it's what people are having to do. I mean, imagine if you were to have a child that is 3 years old, and he or she comes down with Ebola, and you go to the hospital, and all the hospitals are closed. There's no way you can take your sick child. I mean, what are you going to do? Leave your sick child in the street to die? You're not going to do that. So people are having to take their sick back home, in their homes, in their communities, to take care of them, to nurse them. And unfortunately, by doing that, they're spreading Ebola.
Bill Massacoy, thank you so much for your hope, for sharing your experience today. I really appreciate it. We really appreciate it. And we wish you all the best.
Well, thank you so much. Thank you so much for this opportunity, for giving me the chance to talk about my country and what is happening there. And I hope that those who are listening to us again will get involved, get involved. And one of the ways they can do that is by donating today. And again, our website is rebuildafrica.org, and there on our page we do have a space there where people can go and donate for Ebola, and I hope that our listeners will do that today.
We'll make sure that this information will be viewable by everyone.
Thank you.
Thank you so much.
You're welcome.
I'm Yawa Degbe with Arlington Public News. Thank you for watching.